Hello, I'm Mercedes Stephenson, and this is the West Block: politics, perspectives, and players. A critical week in the fight against COVID-19. Parliament was recalled to pass historic spending for those hardest hit by the virus. Over 1 million Canadian jobs were lost, and the scramble for more protective equipment for frontline workers. All of this happening as the country braces for the days ahead, trying to flatten the curve under the new normal. And the message remains the same: stay home.
If I'm going out and I can't maintain physical distancing, absolutely, that's one option, because I want to protect others, recognizing that actually the evidence is not, quite there, but it is an added layer of prevention and protecting the spread to others.
That was Dr. Theresa Tam, Canada's Chief Public Health Officer, on wearing a mask. Late last week, the federal government released its long-awaited modeling on COVID-19. It showed a wide range of scenarios, including a snapshot of this week, estimating that between 11,000 and 22,000 Canadians will fall ill, and that there could be 500 to 700 deaths by Thursday. Breaking all this down for us and what it means is Dr. Jason Kindrachuk. He is the Canada Research Chair of Molecular Pathogenesis of Emerging and Re-emerging Viruses. Certainly very topical right now. Thank you for joining us, Dr. Kindrachuk.
Great. Thank you for having me.
So let's start with the masks, because there's been evolving advice on this, and I think a lot of folks are confused about when they should or shouldn't wear a mask and what kind of a mask they should be wearing.
Yeah, what I want to say to everybody, first of all, is listen, we got introduced to this virus at the end of 2019. So we've really learned everything we have about SARS-CoV-2, which is the virus that causes COVID-19, really in about 3 months' time. And really with that, we've seen kind of a rapid evolution of what our understanding of transmission and disease is. So with masks right now, what we do know is that certain masks offer, higher degrees of protection than others. So that's why N95s are used primarily by healthcare workers, especially in close proximity to patients. Same thing with surgical masks. And then there's been a lot of talk about homemade masks, in particular with cloth-based masks. Homemade masks are really a protective measure if you happen to have an infection and may be able to transmit the disease. You're reducing that ability to transmit to others around you based on the way that this virus carries on respiratory droplets. But that being said, what we have to keep in mind is that really our primary mechanism for defeating this virus and curbing transmission still comes back to this idea of physical distancing. Just like Dr. Theresa Tam had said, we have to be conscious of that at all times.
How long does this virus live on surfaces and can be transmitted? And I'm thinking in particular people going to the grocery store worried when they bring their groceries home about whether or not they have to wash those, about fruits and vegetables, about whether or not they can bake a pie and drop it off at a socially distant location from their friend's doorstep. What are the parameters around that?
Yeah, it's such a great question, and thankfully there's been kind of a handful of publications that have come out recently describing some of this information. What we're understanding now is that the virus basically varies in its ability to remain infectious on different surfaces. So essentially, the smoother the surface, the longer and the greater likelihood that virus is going to be able to remain around and be infectious. And as we get into things like skin, we think that there's actually maybe a reduced level of infectivity over a period of time. So the recommendation is still, listen, for things like paper or cardboard, we think it's under 24 hours. It's probably within the hours range. But by all means, we still think that people can wipe off those types of materials if they want to take extra precautions. If they put them into their cupboards and they're going to sit for a while, that virus is not going to remain stable for a long period of time. With fruits and vegetables, it does come back out to the basic recommendations of what we've always done. Essentially, rinse off your fruits and vegetables and essentially use friction with your hands to clean those off. And at the end of the day, if you're cooking with any of those products, the virus is not that stable that it'll be able to make it through those types of procedures.
The federal government came out with modeling this week showing a wide range of scenarios. How should people interpret those models?
Yeah, my I guess kind of cogent response to that is proceed with caution. What we do know about the models is they're taking in the best estimations they can at the time with the data that we have. so that they give us some predictive power with trends that we may see. But there's obviously going to be quite a bit of variation in those. So I look at models the same way as I do with say snowstorms or thunderstorms. They give us some idea, a bit of a pre-warning ahead of time, but by no means are they an absolute.
There's been a lot of discussion of testing. Premier Doug Ford wants to see more of it. And some people are saying the modeling and our sense of how widespread the virus is very limited because of the limited testing. How important is it to test? Who should be tested? And at what point do you think we should be testing for antibodies to see if people are immune to this?
Yeah, it's a great question. And we know that testing has been highly lauded, obviously, by the World Health Organization. And we obviously saw that early on in this pandemic, that primarily countries within Asia were able to do a high amount of testing and contact tracing and get a better handle on where the virus was going. Right now, the problem is that there's a limitation on the amount of testing that can be done, mostly based on the availability of reagents and kits, because we have essentially a global crisis and everybody vying for the same products at the same time. So what we're seeing right now is that there's a focus right now, obviously, on people that are in high-risk communities or in high-risk age groups. People that obviously are showing obvious symptoms that correlate back to COVID-19, and then as well healthcare workers. So I think that what we're going to see is basically that carry on until a time point when we can actually get more testing kits. Now, as far as antibodies, antibodies will give us a good indication if people have been exposed, but they don't necessarily tell us if somebody is infected at that particular point in time. So what that will allow us to do is essentially over time understand better how the virus circulated within our communities, and it may give us some indication of things like immune responses and long-term immunity or antibody development that may be protective once we start to reduce social distancing measures.
The Prime Minister said last week that essentially social distancing was unlikely to end until there's a vaccine. How far out are we, do you think, from a vaccine for COVID-19?
Yeah, I'm very fortunate that I got to see an interview with Dr. Volker Gertz from the Vaccine and Infectious Disease Organization in Saskatoon last night. They're working on a vaccine here in Canada. The timeframes I think that he lauded are the same that I would consider. We're still probably about 12 months out from seeing something that actually gets deployed, though we know that a lot of people are trying to fast track that, and it could be a little bit less of time. But one thing we need to keep in mind is that with social distancing, as we start to hit that flattening of the curve and see decreases of cases, I think what a lot of people are hoping for is that we'll be able to reduce some social distancing measures in a staggered fashion or slowly over time. And that may at least provide some ability to get back to a semi-normal existence. But again, we are still learning as time goes on, and it's really taking the work of epidemiologists, clinicians, and virologists and modelers to understand what this virus is.
Okay, Dr. Kindrachuk, that's all the time we have. Thank you so much for sharing your expertise with us.
Great, thank you, and keep well.
That's all the time we have for today. Thanks for joining us. For the West Block, I'm Mercedes Stephenson.